and welcome to Getting Your Money's Worth, the show that focuses on value. I'm Judith West, and our guest today is Dr. Deborah Sarnoff, clinical psychologist, clinical professor. Dermatologist, right. I'll get it right.
You have to be psychologist, too, when you're a dermatologist.
Right. I'll get it right yet at NYU Medical School. Thanks for being on the show, okay? I'm going to call you Deborah, so before I make any more mistakes.
Perfect, right, but I'll have to tell you that many times in dermatology, you have to be a psychologist of sorts also. So
absolutely. I think many times in anything you do, you have to be a psychologist. Anyway, thanks for being on the show. And this is a very timely topic for now. It's the sun. We're going to talk about the sun. Tell me something. How prevalent is skin cancer?
It is so prevalent, people don't realize, but the latest statistics, probably 3.5 million cases a year in the United States alone.
Really? How is it that, all of a sudden it got to be such a common, almost household ailment?
I think people are living longer, well into their 90s. The ozone layer is disappearing because of pollution. Awareness is up. People realize if a sore won't heal after about 2 weeks, maybe you should check it out. And I think that all those things together are adding up to the fact that we're just seeing more and more of it. But I think the primary thing is that my generation, when we used to lay out with the baby oil and the sun reflectors, and the beach was where it was at with no sunscreen before we had sunscreen, that and the tanning booths, terrible, terrible that the young people are doing. And you put that all together, and we're seeing a big rise.
So let's take this apart. For one thing, skin cancer is preventable.
Totally preventable.
It's not something that just that luck of the draw.
No, I think you have a genetic predisposition in some cases. The deck would be stacked against you, so to speak, if you had blue eyes, green eyes, red hair, blonde hair, light skin, and lived in an area where you spent a lot of times outdoors unprotected. That's like a setup for asking for trouble. But if you have that genetic predisposition, and if your parents or your grandparents or your sisters and brothers have had skin cancer, and you take the proper precautions, then it's very likely you may never develop it.
So is the antidote for skin cancer abstinence?
It's hard to say that to people. It would be like sex and saying no sex, okay?
Right, exactly.
So
it's not working very well in this country, sex.
It's not. So the next best thing, sun protective clothing, a hat, sunglasses that block the UVA as well as the UVB, and really trying to use sunblock, sunscreen, whatever you want to call it. We have great products today.
Let's talk about this, Deborah, because this show is called Getting Your Money's Worth. And it is absolutely mind-boggling to walk into a chain pharmacy or an upgrade pharmacy or a department store and see the array of sun products. Is there a difference in a sun product that's lower cost, and something at the moon? I mean, is there a better? Is it more protection the more you spend? And will you please break down for us the business of numbered protection?
Absolutely.
So let's go first. Let's go first with my lead in here, Getting Your Money. Price.
Okay.
More expensive? Is it better?
No, not necessarily at all. You're often paying for the packaging and the advertising and maybe the name out there. So no, you can take price off the table right away.
Okay, so now we're down to this numbering system. I mean, I see some things that are like 75. That means you can stay in the sun 75 times longer than you would?
75 times longer than you would normally burn. So if you're going to go out there at noon and burn after just 15 minutes, if you're blonde and blue-eyed and very fair, it means you can extend 75 times 15. Well, you know what? If you do the math, there's not enough hours to have sunlight or daytime.
Right.
So I always tell patients, and most people would agree.
So is that a lot of baloney?
Yes and no. The FDA is looking at this very carefully, and hopefully within the next year, we will have the FDA releasing its latest monograph, which may put a cap at SPF 50. But I would tell all patients that if you get past sun protective factor 50, it probably is really not necessary. So when you see competitive companies going SPF 70, 90, 100, you don't need that. SPF 50 is probably the cap, and for most people who have not had a history of skin cancer, probably an SPF 30 is what they need. But the kicker is they need to apply it correctly, which means thickly, not a thin thing rubbed all the way well into the skin till it vanishes, but more like a
You really
thick
want to go
layer.
out with this white
You do.
second skin?
You do. You do. And every 2 hours, particularly if you're sweating or you're swimming, it's not going to be there anymore. So you have to reapply. So the irony is people buy that bottle and they think that that's enough for the season, for the summer. That's probably enough for one day at the beach for a family of 4.
Really?
That's it.
Okay, but I want to ask you this thing about so many times the normal. Is there such a thing as normal, or is it your norm? Somebody else's norm, your norm? I mean, how do you know what's norm for you? Trial and error?
First of all, the studies have been done oftentimes in the laboratory under artificial conditions using ultraviolet light to simulate the sun. But people out on the beach are not listening, and they're not applying the same amount as what's done in the laboratory, which is why the American Academy of Dermatology and the Skin Cancer Foundation and many other dermatologic organizations have said, let's up it to tell people to use an SPF 30 minimum as opposed to an SPF 15.
Well, how long can you stay out in the sun with an SPF 30?
Well,
the average person.
Probably you want to do 2 hours and reapply.
2 hours.
Okay? And don't forget that the SPF only measures the ability to block UVB. And UVB, you can think of the B as the burning rays. It's what makes you have a sunburn. But the problem, Judith, comes in that there's UVA out there.
Yeah. I thought that's all there was. I didn't even know about UVB.
Well, UVB is the one that gives us the sunburn. So if you listen to what I'm saying and you use an SPF 30 and you reapply every 2 hours, people aren't going to burn if you do it correctly.
And the UVA?
But the UVA, that's the tricky one. That's the one you can think of UVA as A for aging. You can think of it as immunosuppressing us. You can think of it as possibly causing additional problems that UVB, although it's the burning ray, UVA is the longer wavelength that penetrates in deeper. And you see, that's the one that right now, the average consumer, when you pick up sunscreen, you can't tell how much UVA protection is in that product. Hopefully, the FDA will be releasing a new monograph soon with a star system.
So the most serious piece of it is not even rated.
Correct, but coming soon will be a 4-star system.
All right, but in the meantime, we're now. So I want to go back to something you said. You said something about autoimmune suppressive or something like that. I don't want to get too technical here, but there are certain classes of medications that makes one more sensitive to sunburn, and I don't know if that's common knowledge. So I'd like to, since we talk about getting your money's worth, let's talk about that. Ibuprofen. Or
yes,
ibuprofen?
Ibuprofen, which is basically in Motrin. Okay, everybody's heard of that drug. That's something that can potentially make you more susceptible to a sunburn. People have heard of naproxen. There are many things that it's almost paradoxical because they may be anti-inflammatory agents, but they may have a reaction in certain people where they make you more prone to sunburn.
So do the prescriptions for those medications have a caveat on them?
Yes, if you read the fine print closely, you would see that.
So if you read it, you can help yourself.
Potentially, if you know that, yes.
Right. Tell me something. Is it true that if you lay in the sun when you were a teenager, you were an adolescent, and you already exposed yourself, you just might as well go ahead and do it because you've already been damaged anyway?
False. We used to think that most of the damage was done before 18 years of age, but we now know that that's really not true, and that it would behoove us all to really practice safe sun and safe sun protection going forward. And there are a lot of lasers and other ways that we now can reverse some of the sun damage, and then you can kind of start with a fresh slate and go forward. So I would tell anybody who thinks, well, it's over for me because I served in the war and I was in the South Pacific, or I laid out there
when I was in high school or something.
No, absolutely false. Yeah. Keep going with the sun protection.
You use that A word, aging.
Don't we hate that one?
Is it so? Is it so that most visual signs of aging is caused by the sun?
I would say that about 90% of what you see. If you,
90?
In the privacy of your own home, you check out where you've been double protected with your bra and your clothing, and you will see that breasts don't really have those brown spots and they don't look leathery. You check your buttocks, you check the inner aspect of your arm. Why is it that here we really don't have brown spots and we don't have leathery changes, and on the extensor part, which is chronically exposed, that's where we get the changes. So we can't stop the clock, you know, chronologically, time is going to go on, but we could have pristine, beautiful baby skin if we just protected it.
I guess so. Those people that used to, in the Victorian age, wear the long sleeve and carry the parasol, they knew what they were doing.
They knew what they were doing.
Right.
Absolutely. And somewhere along the line, aristocracy changed its value in thinking you need the tan.
Right.
Totally crazy.
What about this business of people now having vitamin D deficiency because they are not in the sun?
That's a big thing, and we do know that the sun does help. In the sun, there's a reaction that happens that you can make vitamin D. However, we know that sardines, mackerel, you can get fortified orange juice, fortified milk. It's much better. A vitamin. You can get 10,000. You can get 1,000 units a day is probably the recommended amount. Some people who are deficient might even want to bump it up to 2,000. Units a day. But we do know vitamin D is important. We're figuring out that in some cases it's helpful against hypertension, diabetes, rheumatoid arthritis, cancers. So I'm not saying not to do vitamin D. We all need vitamin D. The best advice to viewers, get a level checked. If you're normal, perfect. If you're low, start to supplement with diet and food.
And in the little bit of time we left, without, again, getting too technical, can you give, we have a minute left, can you give us some tips for discerning between, you know, a bruise and a sunspot that should be checked?
Sure.
Or anything like that?
Sure.
What's
for melanoma, which is the most deadly form of skin cancer, that's the one we worry about the most. It's the biggest killer of people in their 20s. Look for the A, B, C, D, E.
Which is
asymmetrical. Draw a line down the middle. If it doesn't look the same, think that it may be a problem.
Okay.
B, border. And a normal mole is normal and oval. And if this is variegated or scalloped or funny on the edges, think possibility. C, color. We want to see a uniform color. We have what we call the ugly duckling sign. Look at all your moles. If one sticks out of the crowd, you don't have to be a rocket scientist. It looks different than the others. Run to the dermatologist and get it checked.
Okay.
D, diameter. As a rule, think about the eraser on a pencil. 6 millimeters, usually. If it's bigger than an eraser on a pencil, get it checked out if it doesn't quite look right. And E, we now like that word. We either call it evolving, moving quickly, okay? You had nothing there, and all of a sudden it might be a pink bump out of nowhere, and it's growing rapidly. Get that checked. That could mean something.
Because early detection is very important.
It's the key. It's a cure. Melanoma is 100% curable if detected early.
So a summary here, what we want to summarize is that A, skin cancer is 100% preventable.
Correct.
And detected early?
Detected early, it's 100% curable. I'm not sure it's 100% preventable, but detected early, it is curable.
And all the things in between are meant to avoid it.
Yes.
Okay. Thanks for being on the show.
Thanks for having me, Judith.
You're watching Getting Your Money's Worth. I'm Judith West. Thanks for watching.